Ladies and gentlemen, if you'll please have a seat, we'll begin our next panel. Join me as we welcome to the stage Dr. Jason D. Wright. With a residency and fellowship in gynecologic oncology from Washington University in St. Louis, Dr. Wright is an expert in the realm of women's health. He specializes in treating various gynecologic cancers and hereditary cancer syndromes, employing advanced techniques in minimally invasive surgery and pelvic reconstructive surgery. Renowned internationally for his contributions to gynecological oncology and surgery, Dr. Wright's prolific career spans over 600 publications. Let's give a warm welcome to Dr. Jason Wright. Also to the stage, we'd like to bring Patti Murillo Casa, a former NYPD officer and 14-year cervical cancer survivor. Patti is a resilient voice of empowerment as a women's health educator and advocate. From her role as a wellness coach for Survivor Slim Down to her inspiring journey featured in media outlets, her impact is profound. Thank you and welcome to the Cervical Cancer Summit stage, Patti Murillo Casa.
Great. Thank you all for being here today. It's a real pleasure for me to be here today to join Patti. I want to thank everyone at Survivor, Tamika, who I've known for many years, for all that you all do. So I think the purpose of our panel today is really just to talk about doctor-patient communication and relationships, which I think is really key, especially for patients who are diagnosed with cancer and go through this journey. So I think I'm going to speak briefly just on some tips that I've found helpful over the years when I've interacted with patients. And then I think Patti is going to share her journey. And then we really want this to be interactive and open this up for discussion to everyone in the room. So, I made a few slides just with a few tips, again, on things that I've learned over the years and I think are important when you think about finding a doctor and developing a doctor-patient relationship. And I think, really the first of the things that I wanted to highlight is really, when you start this journey, choosing a doctor that you're comfortable with. You're going to be seeing your doctor, you're going to be seeing your care team a lot. And, doctors have different ways of communicating with patients, different communication styles. And I think when you think about finding a doctor, you really want someone who you can connect with, you can bond with, and who's really your advocate and your partner in this journey through cancer care. I think when you choose a doctor, most important in this room when we're thinking about cervical cancer, you want to have someone with expertise in cervical cancer, and that tends to be gynecologic oncologists. I'm obviously a little bit biased because I'm a gynecologic oncologist, but I think you really want someone who has expertise in cervical cancer, who knows the latest treatments and is able to offer what's out there for you. I think it's also important to think about the hospital and where you're going to be treated when you start making decisions, because especially in the initial phases of care for cancer and cervical cancer, there will be a lot of interactions with your doctor as well as the hospital system. Whenever I talk to patients, I always tell them, and be prepared for your visit when you're going to go in with your doctor. This is something I think when you think about your appointments, when you think about your visits to a medical office, you really want to be as purposeful as possible. I have some tips up on the. Okay. Yeah. No, it was hissing behind us. So yes. So yeah, I think when you go into your doctor's office, you really want to be prepared. So especially for your first visit, it's really important that your doctor has a full understanding of your medical history. So, write down what your prior medical problems are and diagnoses, what surgeries you've had in the past, what medications that you're taking. It's important to bring contact information for any doctors, your primary care physicians, other doctors who are involved in your care. Again, this is hopefully going to be a very long-standing relationship, so you really want your doctor to be able to understand everything about you and your medical history, so they really have a full understanding and can help you make the best decisions on the journey forward. I always tell people to bring a friend or a family member. I think naturally you'll be nervous when you go in with your doctor, so it's great to have another set of ears to hear what the advice is of your doctor, to have another person who can ask questions, maybe approach things in a slightly different manner. So bring someone from your support network when you go in and see your doctor. Make a list of questions when you go in for your doctor. Again, there's some of the visits will be longer and have more time for interactions, but some of the visits will be on the shorter side. So you really want to be prepared. And people often forget what they want to ask their doctor. So write down what your questions are. Think about it so you can jog your memory, and you can make sure you can get the questions answered that you want. And then I always tell people, again, you'll often be nervous during the appointment, so it's often helpful to write down information that your doctor tells you. Again, for most cervical cancer visits, you'll often have multiple interactions with your doctor and your physician and the care team. But it's important, I think, to try to write things down, because you will often forget things that your doctor may tell you. I think communication with your doctor is extremely important. I think, you want to be honest with your doctor. I think, obviously with cervical cancer, it's certainly a sensitive topic. It's very personal information that you're sharing, but you really can only get the best advice and make the best decisions with your doctor if you're honest and you're forthright with your doctor. So again, developing and finding a doctor you're comfortable with and developing that relationship so you can have an honest sharing of information between you and your doctor and what's going on. You really want to, be sure to speak your mind. Again, your doctor's there to be your advocate, to help you on this journey, to make the best treatment choices possible. So you tell your doctor if something's important to you. Again, doctors want to hear what your values are for cervical cancer. Maybe the most important thing is the a treatment that has the highest chance of cure. Maybe it's minimizing the chance of long-term side effects. Maybe it's fertility in patients who are younger. So you want to be able to communicate all of those things with your doctor. Ask questions if you don't understand. I mean, this is really, really complex, and I think the landscape for cervical cancer, I think, is changing. There's surgery, there's radiation, there's traditional chemotherapy, there's immunotherapy that you just heard about. This is really complicated stuff. So you want to be sure when you leave your doctor's office that you've gotten all of your questions answered. And again, try to relax. I know this is easier said than done, but try to be at ease if you can. I mean, it's a really hard time, but again, I think if you're nervous, if you're worried about the visit, it really I think you get the most out of it if you're prepared. You're able to have an open line of communications with your doctor. I think you really want to understand the role of the care team and who's going to be involved in your care. I always tell people, I mean, if people like me as a doctor, it's probably more to do with my nurse practitioner and my nurse than it is often actually with me. So I think it really it does take a team of people. And when you go into your doctor's office, you're going to meet this complex team of people. So there's going to be an advanced practice provider, usually a nurse practitioner or physician assistant. There may be nurses who are involved in your care. There'll be medical assistants and medical secretaries. So you really want to be able to understand who's on the team and who's there to support you. All of these folks are great support staff. Everyone on your team brings something a little bit different. My knowledge as a doctor and what I'm able to talk to you about is often different than what my nurse practitioner or nurse can help you with. My medical secretary develops a lot of strong relationships with my patients, helps them navigate through the system. So all these members of the care team, again, everyone's there to help you, to help you get through this journey and make it through and get your questions answered. So really take advantage of all of these folks and try to understand the logistics of the office. Again, you want to be able to reach your doctor. You will often, will need to communicate with the office. When do you need to speak to your doctor? When do you need to get in touch with the nurse practitioner? How do you get a prescription? How do you get an appointment, a follow-up appointment, a consultation? It's really understanding these things. Again, I think that the journey from cancer is often you want to go from point A to point B, but it's never a straight line in this journey. So there are always ups and downs and deviations from the pathway that you have to navigate. So understanding, this team of people who's there to support you and how they can help you, I think is extremely important. Understand the other resources that are available to you. I mean, I think that's why programs like this and the summit are important to help you know what's out there. So when you're treated, again, it's not just going to be your doctor, your nurse, the nurse practitioner. You know, there's going to be a support system in place to help you with a lot of the other, you know, perhaps, you know, what we don't think of as traditional treatments for cervical cancer that are extremely important. Whether it's a social worker to help with, you know, transportation needs, financial assistance, you know, other, you know, social issues, whether it's psychological support, whether it's other, you know, support services from a cancer center or doctor's office. Again, all of these are there and they're in place to help people as they go through this journey. So you really want to have an understanding from your care team, you know, what's out there and what's available, because there are going to be a lot of bumps along the way. So having these resources is really, really important. And then, you know, I always tell people to you know, to educate yourself. I think, you know, everyone in this room, you already know this and know the importance of having an understanding of the disease process and you know what's out there. So you want to, I think, get as much information as you can. That's going to come from your care team. That's going to come from outside sources. You know, there's a lot of information that's out there. You know, I think everybody you know, is on the web and that they're Googling and you know, looking things up. And, you know, there's a lot of good information that's out there. There's also a lot of bad information and things that, you know, just aren't true that are out there. You know, there's a lot of information, I think, that scares people unnecessarily that's out there on the web. So again, you want to empower yourself. You want to get as educated as possible. You want to be able to have an open relationship and discuss these things with your care team. But just, I think that caveat. And then, you know, I think it's also important, you know, I think a lot has changed over the last 10 to 15 years in medicine, you know, where now most of your own medical data is available to you through patient portals, through hospitals and doctors' offices and healthcare systems. So now you can go online, you can have access to your own information. And again, I think you're going to be your own best advocate. So understanding the tests that you've had done, what the results are, you know, knowing what, you know, when you need to have follow-up and, you know, what the next appointments are. I think you really want to try to understand what the patient portal is and how you have access to information. So I think that's, you know, something now that I think has been a real advance, and I think it's really great for patients. And then before you know, I'll turn it over to Patti. You know, Patti's going to probably share our story. So I met Patti many years ago when I had fewer gray hairs and I was a much younger man. And you know, I think it's really, you know, I think the doctor-patient relationship is extremely important and going through this journey. So Patti was probably going to tell you she probably didn't like me very much the first time she met me in the office, but we're now, you know, 15 years later, and probably over the years, I think I probably learned more from Patti than she's learned from me about all she's done for patients and support and the doctor-patient relationship. So again, this is a journey. Your care team is there to help you and get through this and get on the other side of cervical cancer. So I talked more than I was supposed to, but I will turn this over to Patti.
It's
Thank you.
always okay because in the office I talk more than he does. You're right. It was like a blind date, right? Because I did not know him. I Googled him before going to the office because you know, I was referred to a GYN oncologist after my GYN said that she was going to refer me to a GYN oncologist, right? But she never said cancer yet. Bear that in mind. So, you know, you play it safe and like, oh, it's not cancer, but I have to go and see this guy, right? So I Google him and I see a young face, right? I'm a baby boomer, so I'm used to my doctors being older, right? I like, oh my God, he only been about a year and a half at the hospital at Columbia, New York Presbyterian Hospital, a year and a half. I'm like, oh my God, he just came out of school, right? I like, okay. So I go to him and he's nice, right? I'm like, oh my God, he's so young. Like, will he know what I have? I'm an ex-cop, so I rely on intuition, right? I do. It never stirred me wrong before. So, you know, he took the biopsy. We went through the journey. He right away, because I was diagnosed with stage 2B. Needless to say, my tumor was already big, right? So at the correct me if I'm wrong, at the first look, he already knew without taking a biopsy. Am I right? Right? So but he played it safe. He's like, okay, very nice guy, like calm down. It seems like you have a tumor, we're gonna biopsy it. And he just played it smooth, but I was scared to death. Now, I just told you I'm an ex-cop. I don't get scared easily. So, but once he gave me the diagnosis after my biopsy and everything, and I told him how we're gonna fix this. He said, well, your tumor is too big to be a candidate for a hysterectomy, so we're gonna do it with 35 treatments of external radiation, seven chemotherapy, and 2 brachytherapy. Now, I got the brachytherapy, the 3 days brachytherapy. So it was like a slow motion kind of deal. But when he said my treatment, I got really scared. And he saw that there was a connection, right? He saw my face. I didn't say I was scared. He just saw my face. And Dr. Jason Wright is not a touchy-feely doctor. But that day, he just went like this, right? And he said, we'll travel the journey together. That sold me. That sold me because my intuition said, believe him. Believe him. Right? And I did. 15 years later, I'm honored. And it's a pleasure to have him right next to me advocating. Right? Advocating. And not too many doctors do that. Not too many. So we went through the journey. He was there every step of the way, right? Back then, we didn't have no nurse navigator, patient navigator, what else you said? Nurse practitioner. Back then, it was me and him. That's it. But he made it smooth, right? The journey was not easy, as all of you know, right? But he was there cheering me up. Don't worry, that's the next step. We're gonna go through the next step. He introduced me to my radiation oncologist. Everything was very smooth. And I thank you. I thank you for not only being an awesome doctor, but an excellent human being. Because the compassion he gave me, the understanding he gave me, it was priceless, priceless. And that's what you need in this kind of journey. This is what you need in this kind of journey, because remember, I didn't have the resources that I see now. And I heard Heather talking about hope. I seen this organization. I came into this organization in the year 2009, and I seen it grow. I seen him grow. I saw him get married. I saw how he has a child. And now, because of me, I always say that, right? Because of me, he is the chief of the GYN oncologist of the department. So it's been a relationship. It's been a marriage, right? Without the benefits, of course, right? It's been a marriage. He has, every time I come into his office, right, and I tell him I did this, he gets elated. He gets so happy. He's like, wow, really, really? Oh my God. And one day I came and he said, why don't we offer free pap tests to uninsured women? I said, are you kidding me? He said, yes, let's do it. In the year 2012, we started offering free pap tests to uninsured women. And just last week, was it last week? We done 12 annual free pap tests for uninsured women in New York City. We got so popular that mammography joined us, colorectal joined us, and we offer all 3 free screening for uninsured people in the New York City area. So, and all because of him, all because of him. It wasn't me asking, he was the one who came up with the idea. But he could have said no, to be correct, but he did. He loves it. He's a ham. He likes this, he likes being known. I just introduced him to Dr. Catherine Young. He's like, wow, right? So it's an amazing relationship, and I'm honored that he kept his word. Not only did we go through the cancer journey together, but beyond. He's part of me. We've done interviews before. We've done television before, TV. We've done a lot of things together. And I email him and he gets back to me right away. So, am I lucky? Absolutely. Not all doctors are like this. I saw him and I'm like, oh no, I don't think you're going to be my doctor. But my intuition said the opposite, and I went with it. So I'm happy to say that he's still with me, right? You're not dropping me, right? No, okay. So he's still with me. In May, Cinco de Mayo, May 5th, is going to be 15 years since he said, you are cancer-free. Thank you. So, nowadays you got resources, resources that I don't even know about. You got support groups. You have, like he said, nurse navigators and patient navigators and nutritionists and help me here, and everything you could think of, right? Resources that I hear that gives you hope. It gives me hope to see so many resources that back then, 15 years ago, we did not have. Things going in the right direction, like Dr. Young said. In this Cervivor organization, I've seen it grow, and I'm so proud of the organization. I'm so proud of Tamika Felder, because she's like my little sister, right? Because I am 64 in 4 months, Tamika. Yes, I am. So yeah, and it gives me hope. It gives me hope that my generation is going to be the last generation of cervical cancer. So, any questions?
So any questions from the audience? Hi, I hope you can hear me. I just have one question for both you and the doctor. The services that you guys are providing free, I'm going to use me as an example. Now, I'm from Guyana, right? So I do a PET scan yearly. We do not do that in Guyana. I have to fly to Miami. So you guys are talking about the free pap smear, the free mammogram, the free colorectal test. So what if I pass through? Will I be able to access that service as an international person passing through?
Unfortunately, we at this time we're only offering it to New York City, the tri-state area. But like I said, we have hope, and we could grow it, sure. But at this moment we only use it for the tri-state area.
And, oh, sorry, go ahead, Dr.
Oh, no, I'm just going to add most I think there are more programs now for free screening services, which is what we're providing, but there are also now, more programs for people who are diagnosed with cancer, who have no insurance, who are coming internationally, to help with treatments and access to care. So I think, we're making, headway on both of those fronts.
So I was going to touch on that, Dr. Wright, but I was also going to say, if you want to replicate what Dr. Wright and Patti and the whole team at New York Presbyterian has done, we can give you the blueprint to it if that is what you want, and we can support that.
Yeah, and I'll also add, I think it's one thing for us to be able to offer these services and screenings and pap smears and mammograms, and we can technically do all of these things. But I think what we in the medical field really need help with is we need someone to help us kind of bring the folks in and know that these resources are available. And that's really what I think what Patti and Cervivor and all of the support groups have done, really boots on the ground to raise awareness in the community that hey, these services are available, come in and get access to these screening tests.
Okay, another question from the audience.
Hi, just to add on to that, every state has the breast and cervical cancer program, which does provide free PAPs and mammograms for women who meet the criteria. It is 5 short questions that does not require any paperwork for income documentation. But the limits are, first, as these folks have said, people not knowing about those programs. Second, you have to be with a provider who is enrolled in those programs. And too often, even on the provider side, the patient is listed as self-pay. They pay for the PAP and then can't afford the colpo. So we're really trying to get the word out about those programs, because what's so great about them is not just a free PAP or mammogram. They carry you from the abnormal screen through the biopsy, colpo, treatment, excision, both on the breast and cervical cancer side. And it does provide emergency Medicaid for patients who are diagnosed with cancer. So we really want to get patients from whatever free screening they get to enrolled in those programs, so they know that their diagnostic services are also covered. The National Breast and Cervical Cancer Program, not a terribly inventive title.
Okay, another question.
Thank you so much. If you're 15 years NED and you still have a relationship with a gynecological oncologist where you see each other in the office, that surprised me a little bit. I sort of thought it was like a 5-year space. So can you tell me about hanging on to a patient for that long in the oncology space?
Yeah. So the question is follow up. Typically what we do in our practice is even patients who are 5 years out, which is kind of typically a major milestone for most cancers. We still continue to see patients in the office for their annual examinations. Probably varies based on location. Some people probably go back to their OBGYN for care. They go back to their primary care physician. So I think it just depends on what the care model is. But we continue to see all of our patients annually for follow-up visits.
Okay, another question from the audience.
I'm Travis Michelle, and stage 3B3C. It's very emotional for me. I'm a registered nurse. And hi, Patti. Dr. Wright, your team at New York Presbyterian Columbia, besides God being one, saved my life. For all of you, everything that they're saying here is absolutely true. Dr. Gockley, who's no longer with us, she was one of the best, held my hand and said she'd never leave me. And she did not. And she made sure every test, even with Dr. Chen, who also left, and the doctors that left, they didn't leave because there was a problem, but they had family issues or what have you. But under your guidance as the chief, you guys really hold us accountable for our treatment and never make us feel like we're less than. And being a brown woman, let me tell you, that is huge, because I did go for my second opinion and Dr. Gockley was like, I know you're at another institution as a registered nurse. You know, I'll be here to support you if you choose to go with them. But I was at home. So I want to personally thank you. And for me, you don't understand, just to be able to see you here, because you hear about you and everything when I'm coming there. Thank you. And Patti, to have met you last year, it was my pleasure. And I just say thank you. And it is real. It is true. When you can find a team that really cares about you, like I can't move anywhere. I don't care. It doesn't matter. You're stuck with me. And thank you.
Thank you for saying
you.
that. Thank you. Just to add to that, I never, in the 15 years that I've been visiting Dr. Wright, I never felt rushed. I never felt that I'm asking stupid questions. I never felt anything like that. As a matter of fact, he comes in and he knows that I have a list of questions, and he just sits, and then are you through? Can we do the examination now? You know, that kind of thing, because he never rushed me, never. And I don't know, it's because you're a professor, he likes to teach, because that's how I learned. That's how I learned to take it forward and educate other women, you know? So I never felt rushed, and I thank you.
So Patti, I have a question. Do you ever look back and think, what if you didn't take an opportunity to ask those questions, if you didn't have this amazing rapport with your doctor and use that as a teachable moment, just like you are today?
Sure. You know, I was ready to change my doctor if I didn't, you know, and he didn't quite, I'm sorry to say this, he didn't quite fit he didn't quite fit the box I thought I had for a doctor, right? So he had to sell himself to me. He had to, right? But like I said, you know, I used my intuition. I was in a dark place because, you know, he was telling me I had cancer, stage 2B, right? And I had to go through all these things. I'm like, oh no, right? But it's the tone that the doctor uses, and the way he said, I will travel this. I mean, I use those words because they keep on sounding in my head, right? I will travel this journey with you. I believe them. And that was it. You know, I had to trust that. You have to trust yourself. You have to trust that instinct. It'll tell you 99.9% is right.
Another question from the audience?
Thank you for joining us, Dr. Wright. I was blessed enough when I met my gyn-onc that I asked him if I could audio record. Have you ever been asked that, and how do you feel about that? I know some physicians are hesitant because of legality.
Yeah, I mean, I think it's definitely, you should talk to your doctor about it. I think, you know, I'm absolutely fine if people want to record. Again, you're going to get a lot of information at these visits. So whether it's recording, whether it's taking notes, whether it's having an extra set of ears, you know, the other thing I always tell people, I mean, with cervical cancers, you're going through this, you are going to have, you know, many appointments with your doctor. So we'll often have, you know, the same conversation, go over the same things multiple times to make sure that there is understanding. But yeah, I mean, I think recording, I think taking notes, whatever you need, you know, to help understand the information. I think, again, you want to make sure you talk to your doctor, make sure you're both comfortable with that. But I think it's absolutely reasonable.
Hi, I'm so happy to hear about the relationship that you guys developed. And I am also blessed to have an amazing relationship with my oncologist. But I know that that's not the case for everyone. And I wonder, especially since you're a professor, is what is taught in medical school or in when you're doing your specialty about how to relate to a patient, especially as a male doctor to a female patient, I think is sometimes more tricky and so important in how we feel in terms of trust and care. But is that something that is being taught in medical school?
Yeah, I mean, I would say that it is being taught. I think when you are in medical school and residency and training, I think kind of developing rapport with patients, being able to communicate with patients, developing relationships. I think certainly that's taught in the classroom setting. And then, for doctors, we go through a process of residency and typically fellowship. So you see your teachers and your mentors and how they interact with patients. Yeah, I will say, obviously communication and how you interact with people, it's very individual for both patients and for doctors. So I think everyone has a little bit of a different style, and maybe, there's some people, some doctors that patients may just not click with, and they may not develop that rapport. And, it's nothing against the doctor, nothing against the patient. But again, I think to Patty's point, that's why, I mean, you really want to, I think, assess that when you meet a doctor, make sure that you can develop a relationship, this rapport that you're comfortable with your doctor. So again, I think there's no right or wrong answer. Again, I think this is like any human interaction, and there's just variability.
Thank you, Dr. Wright. Actually, I have a question. My name is Jocelyn from San Diego. There's also talk about the language barrier, right? There are patients that don't speak or understand English. How should one get around that? I mean, should they request a translator? Would you recommend them bringing somebody to help translate? Because it's vital information that they need to receive, but in their language to understand that.
Yeah, I think that, that's obviously, certainly there are a lot of barriers to care, and language is often one of them. I think as patients, it's number one, it's absolutely your right to have a translator. So that's something that should always be made available if you want to have a translator. I think it's also helpful if you're with someone, a family member, someone comes with you who can help with the interactions and the communication. But I mean, I think a translator is always your right. Certainly, in some communities where we are in Washington Heights, there's a very large Spanish-speaking population. I unfortunately don't speak Spanish well, but a couple of my colleagues are, fluent and native Spanish speakers. So if that's something that's important, that's something you can certainly look for in your physician as well. But again, we want to do everything we can to break down as many barriers as we can, including the language barrier.
Thank you very much. We have questions from the audience anymore? No, nothing from chat. Go ahead.
Thank you so much, Dr. Wright and Patti. We really appreciate it.
Thank you.